dangers that are involved with alcohol abuse, the physiological dangers, as well as the psychological. But let's talk about the physiological dangers. A lot of individuals believe that the liver is the only organ that is impacted severely by alcohol. But what we need to keep in mind is that the gastrointestinal system is impacted severely by alcohol abuse and alcohol dependency. Many of the cancers that have been diagnosed have been gastrointestinal cancers as a result of alcohol abuse or alcohol dependence. Now, the interesting thing is that with the liver, the most common illnesses from alcohol abuse and alcohol dependence are acute fatty liver, alcoholic hepatitis, and of course the most commonly known one, which is cirrhosis of the liver. Now, cirrhosis of the liver is irreversible, okay? But the other two are irreversible. Acute fatty liver and alcoholic hepatitis are irreversible once the individual stops drinking. Now, the danger with cirrhosis of the liver is that the individual is going to be advised by a medical practitioner to stop drinking. Otherwise, it can be proven to be fatal. If an individual has been diagnosed with cirrhosis of the liver and they choose to go back to drinking, research has shown and medical practitioners has shown that within 5 years it can be fatal. So it really is damaging to the liver as well as the gastrointestinal systems. Again, alcohol is socially acceptable. Alcohol is used for a variety of different reasons. Celebratory events. Alcohol is used recreationally initially. For many cultures, it's a rite of passage. In some cultures at 12 years old, it's a rite of passage to be passed a beer by your older sibling or your father. It's a cultural rite of passage. In some cultures, it's used just as water at the dinner table. But with some cultures, they have a lower level of tolerance when it comes to alcohol use. Because their tolerance is low, that means that they develop a higher level of dependency with alcohol. And that's where we see many of the problems. We're seeing alcohol abuse and dependency happen at younger ages. When I first started counseling 18 years ago, the average age of onset of alcohol abuse was 12 years old. Now we're seeing reports between 8 to 10 years old with some of these youth. Now we're talking about an individual who is in the 3rd grade having problems with alcohol. So by the time that 8-year-old starts abusing alcohol, by the time they're 15, they could very well develop early signs of acute fatty liver, cirrhosis, or alcoholic hepatitis.